reset the call. Okay, I think it should be recording, so we are all good. Welcome everyone to our October Coffee Chat. It is so good to see you all, so good to be here with you all today. We have a lot of really exciting stuff coming up in today's call, so I am going to go ahead and move us forward. So just a quick reminder about our Zoom features. So we will have a poll today. As always, we hope that you will use chat and reactions and all of the wonderful features that Zoom offers us for today's call. So just a couple of call outs there, but you can see the icons there at the bottom of your screen, and you're able to click on those to utilize all of our Zoom features. All right, and we also normally start off with our agreements for our coffee chats, and so please do take a look at your screen here. There are several, but also I would like to call out taking space and making space. So we have a wonderful opportunity today for lots of dialogue and idea sharing and experience sharing, and we have a very good turnout. I see lots of folks on the call, so we want to definitely make sure that folks are able to share, and so we'd love to highlight take space and make space today. But again, please feel free to take a look at the others on your screen. Okay. So I am going to move us forward because we do have such a great group. I would love if we could do a chat introduction round today. So our question is, which Instagram hashtags or pages do you find useful for your own patient engagement and partnership? So if you wouldn't mind chatting in your name and your location, but also if you wouldn't mind chatting in those Instagram hashtags and pages that you find useful, that would be wonderful. We will get to more about this in a little bit during our call, but we would love to know what you find useful. So feel free to chat in. Let me see if I can pull open my chat. All right, so feel free. Yep. Chris, I see. Don't know of any, so would love recommendations. Chris, me too. So please, if you have some, definitely feel free to put those in. Thank you so much. All right, well, keep them coming. We are going to go ahead and continue on, but please do continue to chat in your introductions today. All right, so I'm sure if you are here today, several of you probably have received our emails, and so we are so excited to offer the PFAnetwork Zoom background. And so we just also wanted to give just a quick little reminder of how to utilize or how to upload that, that background. So in the emails that we have sent, you have the option of clicking right in the email to download the image. And so if you want to upload the image to your Zoom to be able to utilize the PFAnetwork Zoom background, if you just go to the bottom, generally is where your Zoom toolbar is, and then there's the video icon. So it says the word video, and then there's the icon, and then there's that little teeny tiny caret, if you will, the little pointing up arrow just above. And so you're able to click that and then click on adjust background and effects. And then once you click that, it'll bring up the option, as you can see here on the slide as well, that has the spot for virtual backgrounds. And so I put a little arrow here on our slide to the right. There's a little blue plus sign. And so once you have downloaded that image, then you can use the little blue plus sign in Zoom to upload it. And so then you're able to use that image when you're in Zoom, and We are in Zoom right now for our coffee chat, and we most frequently use Zoom, but if you are in Teams or other, especially for some of our other engagement opportunities and such, it's a very similar process. You would go to where your video is, and there's often that spot for uploading a background image. So we just wanted to take a few moments and just, I know we blasted that out and shared that out over the last month, and now that we're all together, just wanted to take a couple minutes and just be able to explain that process. Again, this is Brittany speaking, so if you need anything or if you need any additional help or to walk through, feel free to email me. All right, any questions? Has anyone utilized or downloaded? Oh yeah, Libby, go ahead.
I just wanted to make mention that, as we continue to build and strengthen the community that is all of the PFAnetwork folks, we encourage you to use the background anywhere you wish. It doesn't just have to be PFCC partners activities, but anywhere that you're comfortable or anywhere that you feel like you need that community of people in your back. That's what it's there for. And I just put it in the chat, I think, as well.
Thank you, Libby. Yes, keep an eye on chat today. We have lots of good stuff coming through as we are also having some good discussion. All right, well, wonderful. Thank you all for taking this few moments to listen there. We are so excited about having that background. And we're very excited about today's discussion around social drivers of health. So we are very much looking forward to having a community discussion around social drivers of health. And so first, to get us started, we just wanted to share, and we know that also, if you're in the healthcare field, you may hear social determinants of health, as well as social drivers. And so that SDOH, you'll see that acronym a lot in the work we're doing. And I know we talk a lot about health equity, and it falls under that umbrella very often. And so those are often those non-medical factors that really impact our health. And you can see here on the screen some of those social drivers. These are an example of some that are very impactful to health and well-being. So there's food security and housing security, as well as transportation needs and access to utilities, as well as personal safety. These are some of the examples of some of those social drivers that are impactful to folks' health. And something else I wanted to note is that for healthcare providers, so the Centers for Medicare and Medicaid Services, or CMS, you may also hear it referred to very frequently, also requires screening now as of earlier in this year. And so it's becoming a lot more prevalent to screen for and ask about these social drivers of health. And so we felt like it was very important to also bring this discussion to our PFAnetwork and the community to just talk to you all as well. See if you've been screened. Have you had these discussions with your providers? Have you needed to seek out some of these resources within your own community for your own health and wellness? And so that is sort of the root of this discussion today. So before we move on, we have a poll and we have some great questions so that I can stop talking and we can hear from you all. I'll pause just a moment and see if Libby or Lindsay, anyone from my team has anything else they'd like to add for sort of an overview before we dive into discussion.
Thanks, Brittany. I think the only thing I would add is two things, really. We've been talking to a lot of people about social drivers of health, and that evolution of language is really important, right? Because where you live shouldn't determine what kind of health outcomes you have. And so we want to shift to social drivers of health, being that we know those things where you live might have a heavy influence on your healthcare, but how can we then mitigate those impacts either at the community-based level or at the individual level? And so just want to be cognizant, and man, language in this area is changing so fast. So we do our best to keep up, and we appreciate all of the feedback that we get to be able to, continually improve that. And then I just, on these 5 social drivers, I just wanted to mention that, as Brittany said, CMS is now driving hospitals and primary care centers to assess for these social drivers of health with their patients. And it's an early step. It's not a perfect measure, but it's an early step. At least we're in the conversation, right? And so I just wanted to mention that these 5 are the designated questions on the SDOH screening. There may be more, but everybody has to screen for these 5. So that's why we were sharing this information forward to you. And Lindsay, I didn't know if you had something to add. You've been doing a lot of listening in this area.
Sorry, I took another bite
After
of my
lunch. You thought I was going to talk longer.
Yep. No, I'm just excited. I look forward to listening more. We've learned a lot through challenge cafes, identifying challenges around screening and addressing for social drivers, and then a knowledge cafe gathering everything that everybody knows about, what we need to do to create effective programs. Because it's not just screening. It's not just we're going to screen, gather this information, and then be done. No, there's that connection point and actually addressing the social drivers. And I think that's what we're really looking forward to learning more about. Of course, the whole screening process, but then beyond that, when someone does screen positively, or, how do we communicate that maybe we don't have resources at this moment, but this information is going to help us, create more resources within the community or identify more. So, just always looking forward to listening more. And we can share, I can put the link to our full Knowledge Cafe report
I'm
in the chat. Oh, okay, perfect. Libby's got it.
But you brought up a really good point too that I wanted to call out. Brittany and I were talking about this a little bit earlier this morning. And that is that, screening serves really 2 purposes. And one is for the individual and our opportunity, the health system's opportunity to meet the individual needs. But it's also an opportunity to gather information about where the gaps are in a community, such that the community can take a community-based approach to filling that gap as well. So it's one-to-one, but it also informs the community. I think that's something people who are being screened may not always understand. And so I really wanted to kind of make that connection.
Absolutely. Thank you so much, Libby and Lindsay. Very helpful. Karen, I see your hand up. Feel free to jump in, Karen.
Thank you. As many of you know, I was in Washington last month for the Academy Health Datapalooza, and social drivers of health was brought up. And I heard something, and I'm going to put it on the table to see if anybody else has heard the same thing. But one of the speakers were talking about this, and they said hospitals were reimbursed $8 per patient when this was completed. Has anybody else heard that?
I have not. I know that there's a document that I was looking at a little bit earlier about the numerators and denominators and who gets screened and kind of where the measure is. And right now the measure is simply getting the screening done, but I had not heard any financial incentive for that.
I had never heard any incentives from CMS historically, so that I really perked my ears up. I have seen, and I've been a patient over the past few months in outpatient settings and looking at my portal, and I have seen how they're building the social drivers of health within the portal, which is good. I have some bad news. No one had discussed with me in one of my encounters social drivers of health. However, it was totally completed in my electronic medical record. Not good, right, Libby?
Nope, that's where we really need to stay active in this space as organizations start to stand up their survey and assessments. Yeah.
Yeah, and I shared with, in one of the committees, I think it was my Yale committee for the social determinants of health, how we had all discussed this in one of our meetings and who we thought was gonna be good to really address this, where and when and so forth. And there was one person there that says, well, we're just gonna go in and do click, click, click. And it looks like in my chart, they did click, click, click. And I don't know where we go to address that.
Yeah, that's a great point, Karen. I think having those honest conversations with your provider, you know, starting there, that you're active in your medical record and your, you know, EMR, and you've looked and you've seen these things that were not you. I think that's a big part of what we're talking about today too, is just that open two-way communication and sharing our voices and our experiences. And hey, I noticed this and I saw this, and you know, I don't recall this to be me, so I'd like to talk about this. But I think, you know, it's very important for us to have these conversations and raise our voices when we're seeing things that seem out of place or not right.
Yeah, now for me personally, I go to 3 different facilities, so I have 3 different EMRs. And for the life of me, I'm trying to figure out which EMR did I see that from? And I've kind of gone back to look and I can't find it. So that's my story.
Well, thank you for sharing it with us, Karen, because I'm sure you are in no way alone in this. And it's important for us to be able to talk about it together. And like you said, Karen, to share your story and what's happened and talk about some thoughts and ideas and solutions together. So thank you, Karen. Okay, well, I'm going to move us forward. We have a poll. And let me see if I can pull it up. Okay. Can you all see the poll? Wonderful. Okay. All right. So we would love to know, and it helps us with our collective conversation here together as well. Have you ever experienced being screened or having your needs addressed? So we'll start there and just see how folks respond to if you've had these types of discussions or conversations or been asked by your providers in any way yet. So we'll give it just a moment and see how folks are responding. Give it just a few more seconds and then I'll close. There we go. I'll close the poll. Okay. And I see some folks are writing in for their experience. So we'll give it just a few more seconds for folks to write those in. Okay. All right, and if there's anything else, feel free to put that into chat. So hopefully you all can see the results. So it looks like we're relatively split for those who responded on yes and no. So we have 9 folks who have said yes and 8 folks that have said no to the question of have you experienced being screened or having your needs addressed. So I'll actually just stop really quick and see if anyone has an experience that they'd like to share. Anyone who has actually been screened or asked any of these social driver questions, if you wouldn't mind just sharing with the group how that went for you. How was that experience? Karen, yep, feel free to jump in. Thank you.
So I was at a doctor and received, along with my intake form, clipboard list was, here's the assessment tool. Here's a piece of paper that's separate with a list of resources that you could find if that was something that prompted it. It's good for privacy. There was no conversation with anybody on staff. So yes, that's nice for privacy. I could choose or not choose to follow something if the question prompted, oh, I wonder if I could find help somewhere. But the fact that there was no conversation meant you missed an opportunity to learn something about the way my life works or potential. And I'm thinking that, you know, it's just it's an easy thing to skip over. It's not like the doctor said, hey, did you fill out your form? I want to take a look and understand. So I don't think he knew that I wasn't looking for resources in that moment. I think it was just now we have to fill out this other document moment.
So Karen, can I ask, I'm curious,
Mhm.
what did that do for your responses? Did that impact your responses in any way?
No, it didn't.
Okay.
But I
That's
can
helpful.
imagine that it would absolutely impact your responses because it's a once and done kind of thing. It felt like when you get a clipboard of has your insurance changed, and can you fill out this other thing, and we need access to the portal, and all those other things that you get when you go to the physician's office, it felt like it was piled in with that stuff.
Thank you, Karen. Yep. Yeah, definitely makes a lot of sense to feel that way, especially if there's no dialogue behind it. So thank you for sharing that. Chris, I also see your hand up. Feel free to jump in.
Just really quick, I noticed that once I turned 65, the questions at my doctor's office changed. So there were a lot more questions about safety and security and food and a lot of those things, which I think is good. It's weird because now you have to do all these different things because all of a sudden you're 65. Like these things have been around for a long time, but you know, I didn't have a lot of issues, so we didn't have conversation on it, but I'm sure our doctor's really good. If I had marked something that I needed help on, he would have. But secondly, I also wanted to say that we provide a diabetes prevention and diabetes education programs. And it's through a grant with CDC, and the CDC has had us change our enrollment questions on the diabetes program to ask questions. Do they have access to a computer? Do they have access to food? Do they have, all of those social determinants of health questions? So it's becoming more prominent out there. And I'm interested to see what the responses are.
Thank you, Chris. I have also heard about that when the questions start to shift. So yes, thank you for sharing that. Karen, I see your hand up as well. Feel free to jump in.
So I am an emergency medicine physician, but dealt with some food insecurity as a young child. And I know that I would have had a very tough time answering that question truthfully in high school, to say that I didn't know where I was getting my next meal from. And since the rollout in January of 2024, when we started having to ask these questions, I do see that some of my colleagues shy away from asking the questions and instead try to dissect the chart to see if they can find that information somewhere in it, because it is a challenging conversation to have. And trying to figure out how to word it so that the person doesn't feel shame. I've tried multiple scripts, and there have been patients that appeared to be undomiciled who definitely said, oh yeah, I've got a place to live, I'm totally fine. But you see them with their 3 suitcases, their backpack and everything, and trying to word that, these are factors that we found can affect the health of a patient. And so this is not to pass judgment over anyone, but it's to help us better understand how we can provide resources. And I was wondering if an anonymous questionnaire is easier for patients to be truthful on, because then they don't have to see the reaction from the person who's drilling down the questions, who looks completely tired and not taking in the answer. All these requirements of, are you at a fall risk? Do you have access to Wi-Fi? We're having all these increasing demands placed upon us, but we're still expected to see every patient within 25 minutes of ED arrival. So I feel pretty darn strongly that we need to allow providers to have more time at the bedside and stop expecting them to provide care within 25 minutes like it's a Domino's pizza. You guys are not Domino's pizzas. You are very individual and you deserve to have more time. Thank you.
Thank you, Karen, for sharing. Those are really helpful insights from a different perspective. So thank you so much for sharing those with us. Hi, Jan. I see your hand up as well. Feel free to jump in.
You bet. I have to say, as Chris, I've passed the magic age. I don't remember ever being asked those questions before my annual wellness visits with Medicare. I've had them asked both verbally and on paper. Myself, I prefer it on paper. And I feel like I can answer honestly. And I do feel like it gets looked at. I have a great primary care physician, and I believe that her attention would be brought to that if I indicated that I had problems. So I think it's a great thing. And I think it's required of all annual wellness visits. Is it required now of every primary care doctor visit? I don't know. I
don't know if it's required, but a lot of people do. In my experience, every time I go to the doctors, they ask us the questions. If it's a different doctor, they ask the same questions. It seems to be a normal thing for us here. So I think it's required, being on the board of directors and having seen the finance, I know it's required, but they also get their, 5 or 10 cents for it too. So everybody should be doing it. It helps with funding too.
Thank you, Jan and Roger. That's helpful as well. Thank you for jumping in. Lindsay, yep, feel free to jump in.
Yeah, I was just thinking back to Karen's comment and others, about the time and that it takes, to have these really intentional conversations and to gather this information in, I guess, an authentic way. So what we have been looking at is like looking at it like a program. So how can we support providers who are asking these questions to feel confident and feel like they have the time or can take that time to have, a conversation around it and explain, why we're asking these questions and what we'll do with that information. And so I feel like I've been thinking about it in two different lights. How can we support the quote unquote general population? I know Stephen on our team won't like when I say that, but the general population and understanding, why these questions are being asked, what's being done with this information. But then also on the other hand is, those providers who are asking those questions and, how can we make them feel confident? So Karen, they're not just clicking boxes, or they're prepared to hear, the struggle and the challenges and the needs that patients and family caregivers are having. And I think it does take some out of the box kind of collaboration and thinking about how we can kind of create more supports for both providers and patients who are being screened as well.
Thanks, Lindsay. Yes, that out-of-the-box thinking is something we'll definitely talk about. And if you have thoughts and ideas as we're talking, definitely feel free to drop them in chat. I've seen some good stuff coming through. Lori, I see your hand up. So we'll go Lori and then Cynthia.
So I find that when I work in pediatric healthcare, but I also have kids who use the system a lot. And I noticed that when we go into our ambulatory services, we're handed a piece of paper with one or two questions on it, and that's it. It's usually around safety, but we're now doing a lot of suicide screenings that way as well. But it feels very impersonal, and there's nothing attached to that at all. When we screen for social determinants of health in our emergency room, we do it in a very non-judgmental way. I had to be a screener when we trialed it, so this is the only reason I know. But we took in iPads And the cool thing was that we had a really good non-judgmental script when we went in. We were able to leave the iPad in the room, and then the provider, before they picked up the iPad, when they discharged the patient, then they take the iPad out. But everything would like erase. So it went to a portal where we could see if we needed to offer them services, but it was non-judgmental in the way that they didn't know where it was going, and their provider wasn't the one who had to like provide the service then. So they could get the care that they needed from the provider in the room, and then a social worker or someone would come in if they screen positive and then go over services and resources with them. So very non-judgmental, and it didn't have to make families feel that they couldn't receive the care from the provider that they were getting, or that they would be judged in some way.
Thank you, Lori. Thank you so much for sharing that. Karen put brilliant in the chat. Can I just ask a really quick follow-up, Lori? So did you all ever do any follow-up down the line with those folks, just to see were they able to get connected to resources, or feel, yeah, just.
So we actually have a whole program around social determinants of health now, especially for our emergency kiddos. So they receive resources from social work or from their nursing staff while they're in the emergency room. We have a follow-up program that follows up with them 2 to 3 weeks later. It started off being connected to food insecurity. We have lots of food deserts where we are. So that's where it began, but now we can also connect families to housing resources and some other things as well. And we follow up with them a few weeks later. And then if we felt that they needed additional follow-up or they asked for it, then they have someone that can do that as well. So it's ongoing.
Yeah, that wraparound, very helpful. Thank you for sharing that. Let's see, Cynthia, I saw your hand up. I just wanted to check, did you want to chime in, Cynthia?
Hi, everybody. Greetings from the Bay Area. Hey, Libby and Brittany, my girls. I love those two. They always there for me. Yeah, we finally getting a break in this hot weather. It rained for all of 2 seconds, but Brittany shaking her head, but it's not as hot. You know, I don't know if my situation is different, but I'm a part of an HMO. And okay, so my particular and you guys, my husband is listening. He's here with me on the Zoom call. So yeah. And we both have the same HMO, and neither one of us recall them ever asking us about our social determinants. I do have one doctor who brought it up, but then he was quick to remind me that he was just a pharmacist and that he encouraged me to bring it up. But as the other young lady said, they only give us 15 minutes. And, you know, the first 5 minutes is spent rereading my chart because they didn't, you know, what are you here for today? Did you read my chart? You know, did you read the notes? That's 5 minutes. And then they ask you to go over your medication list again. You know, so I'm left with like 7 minutes left to talk about what I'm there for. And the social determinants never come up. Now, my HMO does have member services that we're supposed to reach out to, and I did twice. I asked them to send me information, and I still haven't gotten it. You know, I don't have a computer. I just have this little bitty iPhone, and I can't see the little words on 25-page documents. You know, so I've asked them to send it to me. And the last thing I wanted to bring up is the fact that I have been disabled, having lupus for 24 years. I'm about to turn 65. I don't even know what's out there. I did not know that I had a transfer from disability to, you know, that's the whole other thing. Had I not thought about it, I would have missed them, because now it's open enrollment. And I've got 6 weeks to try to wade through all this information and figure out what I need. By me not, and that's a lot to say, but by me not being 65, I never qualified for senior benefits. Now I qualify, but I don't even know what the benefits are. And the ones that I've looked into is an extra fee. Like, and I'm supposed to get, so, you know, it's a lot. And I just want to say thank you for having this chat today. He and I both are listening, taking notes, and I really appreciate the doctor's perspectives as well. So that's what I wanted to say. Thank you, ladies.
Thank you, Cynthia. Thank you so much for chiming in and for sharing. And also, everyone take a look at chat because there's some great stuff coming in as we're talking. So I won't call everything out, but please take a look. And thank you again, Cynthia, for that reminder too about open enrollment. So Chris, I see your hand, and then Roger will go to you after Chris.
Hi, I've been working with Comagine, and I've heard about this patient hub that they have down in Las Vegas, and they're trying to work with people who are, it's a maternal hub, and they're working with pregnant women to try to bring down the incidence of mortality, but also to get them higher birth rates. And what we found is that we're trying to tap into the community health workers. And I just wanted to mention that here, if you haven't tapped them in, I think they are the ones that really have a handle on the social determinants of health and what's out there and what people really need. Because I wouldn't know where to start, but these community health workers that are really in the trenches and talking to people every day are a great resource.
I just love that you shared that, Chris, because in our, I think it was the Knowledge Cafe that we did. It was at the Putting Care at the Center conference put on by Camden Coalition, which is happening right now as well. But we did that last year, and there was a community health worker that joined us to talk about their role in, you know, this entire social drivers of health program. And you'll see if you take a look at the full report, there's a lot of mention of community health workers and you know, just reimagining their role in what social drivers of health are, you know, is that the kind of out of the box thinking or collaborations that we need to make, is, you know, more intentionally bringing in community health workers to even do the screening process. They may have better understanding of those community resources. So yeah, I just really appreciate that you said that. Wanted to put an exclamation point on it.
Thank you, Lindsay. Roger, yep, go ahead. I see you.
So I'll continue with the community health joys, because I'm with Community Health Center here in Des Moines, and you know, we have a lot of people that are uninsured and a lot of people that are undocumented too. So asking those questions is so important because we get frontline firsthand right there. And a lot of times we don't expect our doctors to be asking these questions because, you know, again, they only have 15 minutes. So when we go in with the first nurse who does your, you know, your C's, whatever they call them, assistants, they ask the questions, and then, you know, they do your blood work and, you know, your blood pressure and stuff, and then they can also have the resources when if you say, yeah, I'm not, you know, making it. So it doesn't take away from the doctor's visit at all. And I mean, that it keeps our doctors happy, but it also keeps the patients happy at the same time.
Thank you, Roger, for sharing that. Yes, striking that balance is definitely important. So thank you. Beverly, I see your hand up.
Good afternoon. I think it's afternoon for everybody. Good afternoon. You know, healthcare system, they really do have a big job because it's going to be hard to drill down for everybody. Those of you who don't know me, I live in an independent senior community, and I hear lots of stories. And even though they think they're asking the right questions, they have to know the person that they're asking, because some people need to ask the caregiver and not the patient. And what happens is you have the patient trying to make a decision and the caregiver is saying, no, I can't do that. Or no, that can't happen, or it didn't happen. So I mean, that has to be a headache in a hospital setting. And the other thing is there are so many times when you go into the doctor and the first thing they ask you is about your billing. And like Cynthia says, even when I go online and ask all of the online, pre-visit questions, when I get there, they're going to ask me again, and I get a paper sign off that you're going to pay the bill or somebody's going to pay the bill. And because I'm over 75, I think it's over 65, CMS at your annual wellness visit supposedly requires your physician to ask you those questions. Now, if it's someone like me who will ask the questions or tell you the answer before you ask the question, they just leave it. And so there's nothing that goes on the chart. But if it's someone who's very timid, you may get some answers, no answers, or just plain out and out fibs. So it's a big issue, and I'm not even sure at this point how you solve it on both sides, but there needs to be communication between the different healthcare systems, the patients, and the clinicians. Where are we going to get that? I'm hoping that somewhere, Libby, you have the answer.
No pressure though, right?
No pressure. No
You
pressure,
know-
Libby.
You know what my answer is, Beverly? It's the same answer for everything. Co-design. We got to design it together. We got to design screening systems together. Patients, family caregivers, health systems, community partners. We have to design them together for them to work with it for everyone. But that's all.
What I would hope, Libby, is that we don't just do hospitals, because when you start looking at the elderly come out of hospitals and they can't always go home. And there is a big issue, big challenge when they go into rehab. They sit in rehab, depending on their insurance, whether they go into up to the nursing, skilled nursing part of it, or whether they go home, or whether they find assisted living. So the elderly, and if you're blessed, all of you are going to get to be my age, and you're going to have to find a way to address some of these issues. And there are questions that you nor your family can answer right now.
As always, Beverly, giving us so much to think about. I really appreciate that. And I see, I'm just going to call out Karen's comment in the chat about anything represented in the accrediting bodies. My guess is no, because it's only a year old, but it's worth looking into. So I will pull that back.
Libby, if I might, the Joint Commission is starting to look at this. They've got some high-level standards. I've got a committee coming up with the Joint Commission in a few weeks, and I'll see if that comes up. And when it does, I'll share that with this group at our next meeting. But they tend to do high level and nothing really specific. But they will tie it mostly under leadership, because leadership must be directing everything.
Thanks.
Yes, thank you, Karen. And thank you all. This has been a really great discussion. Before we move forward, we have a couple of other really great things that we'd like to talk about before our time is over here in a few minutes. Does anyone have anything else they'd like to say or share around social drivers of health? Again, these are really wonderful conversations that we love to bring to the community, but definitely not intended to just end today. We have so much more to talk about. So, Beverly, I saw you come off mute. Were you going to say anything else?
Real quick, in case you didn't notice, if you have an insurance provider and you can change, please review and make sure that you're getting what you need from your insurance provider. If you're not, you are paying for them. Even if you're on Medicaid, you paid somewhere along the line. Make sure you get the kind of health care you are looking for and you need.
Beverly, is that specific to Medicare, Medicaid?
If you have insurance, I'm not sure if you can do it for Medicaid, but you can, but a lot of the doctors you can change in Medicaid. You may have Medicaid, but a lot of times, depending on the system, you can change your doctor.
Thanks. Great reminder.
Absolutely. Thank you, Beverly. All right, I'm going to move us forward. Carla, thank you for your note that you just put in chat. Others feel free to definitely take a look. There we go. But I'm going to move us forward. We have just a few more minutes left in our call. These coffee chats always fly by. Such great conversation. So thank you all. So we are very excited to share with you all and introduce our PFA Network Instagram. So I know we connect quite often with each other on LinkedIn, I think very frequently, but we had some great feedback and have now decided to launch an Instagram page for our PFA network community. So Libby, if you would drop the link into chat if you haven't already. And if you have Instagram, please do follow the page and just keep up with us. If you are like me and need to create an Instagram page to follow, please do as well. But we are hoping to just continue to share all of the great messages, the great work that we're doing, the skills development opportunities, engagement opportunities, all kinds of things. And so this is just another way that we could all continue to stay connected with each other. And again, earlier in the call, we talked about hashtags that are helpful and different pages you follow. So just another way for us all to continue to feel and stay connected as a community. So again, please do check us out. We'll continue to share this. I know it's gone out in our not emails yet, but I will make sure to put it on forums and when we get the newsletter. So we'll continue to share it and for you all to continue to share it, because one thing we'd love to do is to continue to grow our PFA network community. So please do take a look. All right, and then talking about PFA network activities. So last month was the launch of our Building Bridges series. We had several representatives from the disability community come and share. And again, the purpose of the Building Bridges series is really to create a sense of belonging within the PFA network. And so we will continue to feature different communities and different topics over time. And so it's crazy enough to think that we're getting towards the holidays here and getting towards the end of 2024. So we are very much looking forward to launching another Building Bridges series at the beginning of the year. But if you have different thoughts or topic ideas that you'd like to discuss or hear from when it comes to building bridges, please do feel free to put it in chat or reach out to me by email. But we will continue to keep this series going as well. And then another very exciting upcoming skills exchange we have is quality improvement, or QI basics, for patient family partners. And so another link coming at you in chat. We will put that registration link in chat as well. But this will be November 6th and 13th. So it's 2 parts, 2 back-to-back Wednesdays. And it's just really an incredible opportunity at no cost to you to come and learn more about quality improvement as a framework. So it's really wonderful for all of our partnership efforts that we are all taking part of together as a network. And so very excited about this offering coming up in November. So please look out for that registration link, register, and we hope to see you there. All right, now I am very excited to turn it over to Libby to talk to us more about our language access plan. So Libby, do you want me to keep this slide up, or do you want me to take it down and post the document?
No, you can keep that up.
Okay.
So we're always learning over here. You know, we're always making lots of mistakes, and then we learn from them and we move forward. So I had an opportunity to be required by CMS to run a document through 508 compliance. And I thought, 508 compliance, I don't really know what it is. I don't know, do they have an app for that? So as I started looking into it, I realized, oh no, we should be doing this all the time. This is actually part of our commitment to be inclusive. And so it led me to a lot of different conversations and a lot of different input from people who make their living as interpreters and people who are working in cultural humility spaces and in the disability world. And so kind of all came together for me about, what can we do as a very small organization with limited resources to be able to engage the broadest part of our community? And I'll just pause there and say one thing that we've noticed as a team is we have 1,100 people receiving our mailers on our mailing list as patient family partners and PFAnetwork members. But we consistently have about 300 folks that are really engaged with us and doing the things. And so how do we reach that other? And, one of the ways is how do we be more inclusive? I think that Anthony Sanchez just rings in my ear all the time about how do we make it easier for people to participate. And so we put together this language access plan. I actually took a small course and got certified in creating language access plans. And then put our own spin on it a little bit to put our linguistic needs in terms of translation and interpretation in the same plan with our desire to meet the needs of our community members who are either low vision or low hearing. Now, I will say I am just stepping into this and understanding. And so I was trying to put this access plan together and say, who am I missing and what am I missing and what strategies are available to people with low vision who are participating online? And the answer is, I don't know, but all of you do. So we're going to do a great experiment together. And what I've done is put the bare bones of these topic areas into an online Google document and made it wide open for anybody to put their information in. So maybe you don't have information about translation interpretation, but maybe you know something about how to reach people with low hearing level. So I invite all of you to go to the Google Doc to, oops, I was trying to put I can't put in a link at the same time I'm talking. I really want you to, I would invite you to put your thoughts in. What have you heard? What do you do at your organization? How do you accommodate your patient family partners in this way? What are your needs if you have needs that we don't know about? So you'll see this question coming up on our questionnaire, on our interest questionnaire, because we want to know, I don't even know who needs what in our community. So we're really leaning into the community to teach us. And just would really appreciate any few minutes you can have to add to this language access plan so we can be as inclusive as possible. Any questions? And Cynthia, I know that's inaccessible for you to be on Google Docs, so feel free to just call me, send me an email, whatever it is with your ideas as well.
I have a question, just for clarifying.
Yes.
Is translation and interpretation, isn't that the same?
Great question. I learned this, Roger. Let me share my newfound knowledge. Translation is translation of the verbal, of in-person live talking. I'm sorry, I said that wrong. Translation is translation of documents. Interpretation is the live verbal translation. And I noted that in the document so that everybody. Yeah. But I think I got it wrong when I first wrote it in and I had to flip it. It's all good now. We're all good. We openly make mistakes and invite you to share your mistakes and your learnings as well. All right, if you have any questions about this, I'm leading this aspect of the network and happy to receive your thoughts. Thanks, Brittany.
Absolutely, Libby. Thank you so much. And I dropped that link into chat. If anyone wants to click it and give it a try, just to let us know that it's working. But yes, just Libby, thank you for your thought leadership and opening this up for the community to be able to go in, because like you said, none of us will know all the things, but we have such a wonderful networking community behind us, and we all know a little about a little, so we can all put it in there. So thank you so much. All right, everyone. Well, thank you so much for your time today and just being with us as always. It's always so bucket filling for me every time we have a coffee chat, just to come together with you all. It's always such really, really wonderful, candid information that's shared. And so as we are continuing to have our coffee chats and and go throughout our month, please continue to think about referring a friend to the PFA network. We are continuing to grow our network, and so there's the PFA network interest questionnaire, and so we will be continuing to also make enhancements. And so we also welcome you, if you're ever clicking on one of our links or filling something out, if you notice anything, please do reach out to us, or let me know as we're continuing to make enhancements. But this interest questionnaire is also just a really great way for us to know what you're interested in and your experiences. So as we're getting opportunities coming into us from different healthcare organizations and systems, we can do our best to try to link and match and make partnerships for the important co-design work and everything that we've talked about here today. So thank you all again so much for your time, and hope everyone has a really wonderful rest of your October. Reach out if you need anything, but otherwise we will talk more soon. Thanks, everyone.
Bye-bye.
Bye. Take
Bye,
care,
everyone.
Thank you. Bye.